Yeah, what a powerful message that is. And someone that I know has heard that message many times joins us now. Dr. Graham Newstead is a bowel cancer expert. Graham, thanks for joining us.
Good day. Nice to be here. Thank you.
Helen said it's not a glamorous topic. However, bowel cancer is one of the most treatable cancers if caught early. Is that correct?
Well, absolutely. And Joe was talking before about it not being a topic we want to chat about, and I'd like to make a dinner table conversation. It really is time. Yep. There isn't a woman in Australia who doesn't know what a pink ribbon means, and it's time we did this for bowel cancer as well, because the difference between bowel, breast and prostate, the latter two being the most common in the different sexes other than smokers, is that bowel is potentially preventable from polyps to cancer, the little growths, whereas breast doesn't have a pre-malignant condition, and neither does prostate, most common in the two sexes. But bowel is a preventable disease because it has a pre-malignant condition that we can find.
Well, I think it's just incredible that we're lucky enough in this country to have this service that is delivered to your door. It's a little reminder when you turn 50, happy birthday. But why when we turn 50? Is that an age at which it becomes more risky?
The peak incidence of onset of bowel cancer is 69. That's what I grew up as a medical student believing. We are now seeing, of all the cancers that occur, 1 in 10 are in people under 50.
Hey, Graham, what percentage of people do you estimate are getting the kits received on their 50th birthday and just throwing them away or not following through, like Helen told us?
It's wonderfully gone up by a tiny, tiny amount. It's gone from about 38% a few years ago to 41%. Big deal. That means 60% of people are still throwing them in the bin. They're saying, yuck, I'm not going to do this. So we went back to the government, Bowel Cancer Australia and other groups went back to the government and said, you need to have an awareness before you send out the test kits so that people know what they're going to get, and then they do it. And they've done that. We've gone up a bit, but it's still the yuck factor. One of the most common things that I will hear from a male patient that comes in for a colonoscopy when we're doing the telescope round the bowel, possibly for a positive test, FOBT, is that I'll say, I know you're here for a colonoscopy, but what brought you to come and have it done? And it's not infrequent for him to say, this is my wife's 50th birthday present to me. And I think the girls are the girls are the nurturers. My wife would not come down a ski slope once she'd had a baby as fast as she used to. And I think the girls get their breast checked, they get their cervical pap smear done, but they don't want to do, the guys especially don't want to do the bowels because they're macho and they're all right and it's going to happen to somebody else.
It's estimated 4 million kits will be sent out in the new year. Potentially, how many lives do you think you could save?
Well, theoretically, and probably not practically, but theoretically all of them. So we're talking about 15,600 cases in Australia per annum, and there are 5,300 deaths. Now, that's 103 people a week dying from a disease that you don't have to die from, because if you get a positive fecal occult blood test, the test kit, then you have a colonoscopy.
Which I get regularly, by the way, and they're not that big a deal.
No, there are worse things in life.
Yeah,
like,
I mean, the preparation's worse than the actual event.
Much worse for me was getting delayed by fog in Sydney the other day coming home from America.
Oh, that's a nightmare.
Shocking. So, and it's not too big a deal. Yeah. But the only people that need the baseline colonoscopy will be those with increased risk. So if you've got a family history of bowel cancer, or you've had previous polyps or things like that. But if you have a positive FOBT, then you must get a colonoscopy in good time. And that's another problem we have, in that the more people that take up the test and do it, the more people that are on waiting lists for colonoscopy. And then, of course, one is federal and one is state. The federal government do for us the national screening program, fantastic. But at the state level, they then have to provide colonoscopic services for the positives. And we have good evidence to say that if you wait longer than 4 months, you will reduce your cure rate.
Oh, geez.
Because the cancer may have spread.
Well, Graham, it's a simple process that can make all the difference. So we really appreciate you sharing your insight with us today. Thank you.
Thank you very much for having me.
Plenty more to come on the House of Wellness. But up next, we tackle the trend of vaping and ask, is it just an excuse to smoke? Back after this on the House of Wellness.